Hello, everyone. We're just going to wait for a few seconds here and let a few more people join in before I get started. Welcome. Hope everybody's having a great day. All right, it looks like I can get started. Welcome, everyone. My name is Brenda Navin. I'm the CEO and founder of Launch My Health, and welcome to this webinar today. I'm very excited to talk with you about my passion. It's what we do as our core business here is nutrition benefits, and excited to share more about that with you and hopefully help you become a more discerning buyer about nutrition benefits, what's worth it and what's not. And hopefully you'll have some key takeaways today that you can help if you're a broker or if you are a buyer in the employer market too. And I do want to make this really interactive, so please use the chat feature. Amanda Knutson is on our team and she's the moderator today, so she'll be monitoring the chat. If you have any questions, please put them in. If there's like some burning questions, she'll interrupt me too and we can answer it right on the spot if it's really relevant. And we'll have time at the end for Q&A also. And please watch your email tomorrow for a post-webinar recording. We will be sending out the recording of this. So in case you want to look at any of the slides, you can certainly do that. And in there, we'll also be sharing a download that you can use to help you decide what kind of nutrition benefits you might be interested in and help you be that kind of discerning buyer. So for today, the goals of the webinar are to sharpen your lens as a benefits decision maker or a broker, learn the pros and the cons of common nutrition benefits. We won't be covering all of them today, and I would ask all of you too, if you have questions or you've used different kinds of nutrition benefits with success or maybe not success, please don't name the company in there if it's not positive, but put that in the chat too so that we can all learn from each other. And then also we want to take away a framework, and this is what you'll get in your webinar, post-webinar email tomorrow, is a framework that you can use as when you're looking at vendors. And before I get to that side, I do want to put up the poll now. Amanda, can you put up our first poll question? So I would love it if you guys would answer this. And our first poll question is going to be about nutrition research. So what is the increase in nutrition research since 2002? So we have more nutrition research happening, but what is the increase? And I'm interested to see what you guys think on this. And Amanda, when we're done here, I will have you put up the answer. And we got 38% in the 50-fold and 25-fold, 10-fold. Nobody said 2-fold, which is good. And the actual answer is 25-fold. So we have had a significant increase in nutrition research over the past 20-ish years, 20 plus years. And years ago, what we were focused on was like micronutrients and vitamin deficiencies, and that research has really changed to how do we use nutrition to prevent disease and how do we use it to manage disease. So what was happening 20 years ago is not what's happening today. So I have another poll question for you related to that, which is on the diabetes prevention program, which was created by the CDC. And when was that research taking place? Was it 1990 to 1995, 1996 to 2001, 2003 to 2008, or 2010 to 2016? You can put your answer in there and let's see what the answer is to that. Wow, you guys are a smart group. You are absolutely correct. 1996 to 2001 is the correct answer, and you guys did a great job on that. So today, diabetes prevention program is still one of the most common prevention programs that we have, and it's based on nutrition research that is over 20 years old. So that just, I hope, can sit with you and think about like, what do we need to do to change to the way that we're approaching chronic disease prevention and optimizing our health, and how do we incorporate newer research into the solutions that we're choosing for our employees. Because after all, I think most of you are here probably because you want to, one, improve the health of your employees, but you also want to make sure that your company is thriving as well. We want to have happy, healthy, engaged employees so that businesses are successful. So it's twofold. It's the health of our company and it's the health of our employees too. We're also trying to mitigate costs because we have health plans that are going bankrupt today. We're looking at astronomical increases in health plan costs. So nutrition is one way and one of the most powerful levers that we can pull in terms of making an impact. All right, I'm going to move on to the next slide. All right, so food as medicine is absolutely exploding. Employers are investing big money in a variety of ways. Some of that can be in solutions that they're doing, or it can be culturally also. And one of the problems that we see in this food as medicine space is that it is growing so rapidly. There's so many vendors coming into the marketplace, and there's also a lot of legacy vendors too. Some are hitting the mark, some are not hitting the mark. Some have really great ideas, but there's really poor outcomes. And in the end, employers want to be spending money on solutions that are actually going to work, that are going to move the dial, and that their employees actually enjoy. So the latest research that I've seen to what people are really concerned about spending money on, it's MSK, it's cancer costs, it's the biologic medications, GLP-1s, weight loss. So these are things that everyone's grappling with, and how can nutrition fit into that picture and help you be more successful? And we have to think about things differently and think about how it's not just at the end of the line at chronic disease. So that's what we'll be kind of sharing more about today. So with thinking about food as medicine and that explosion, everybody's talking about food and nutrition today, which I'm thrilled with, because for me, as somebody who's an entrepreneur and started this company based on food as medicine, I spent 22 years in the healthcare industry and wanted to see a difference in nutrition, and I wanted it to be available to the masses. And now all these other solutions are coming into the market too, which I think is great, that there's a lot of opportunity. But we need to be really cautious about layering these shiny perks without a foundation and a strategy. So it's like going towards the shiny object. And that an example of that would be just throwing money at like fruit and vegetable stipends without having education. So it's teaching a man to fish versus handing him a fish. And that's where we're really going to get a high impact. So we'll get into that as we go a little bit further. And with that framework, as I mentioned in the webinar, post-webinar follow-up, you'll be getting a framework that you can take away and use yourself. But within there, what you're going to see is how you need to be clear on your budget and your culture first, and really think about what your goal is and then work your way backwards. So we want to achieve this. How do we get there? And that how do we get there is going to help drive what your decisions are. And it doesn't necessarily have to be a nutrition vendor either. It could be a culture change in your organization. And that's where this gets kind of complicated, but you can use that framework to help you figure that out. And you just need to start somewhere. And lastly, in here is you need to really invest in what actually moves the dial, and that's going to be the last piece in the framework. So don't worry, I'll show you what that actually looks like at the end of this webinar. And then you can use that on your own, or you can, we're happy to help with that too. So in the end, this framework for evaluation really is around clarity, culture, and impact. And those things have to work together so that you have the best solution and the best strategy for yourself. So before we get into the actual nutrition solutions, and I'm going to break down all of these for you, I want to talk about the levels of food as medicine. And before I talk about that, let's define what is food as medicine. If I go into Google right now and I type in food as medicine, a lot of times what comes up is an AI kind of definition. It's searching the internet and the web for what food as medicine is, and MTM, medically tailored meals, often comes up. And it's really focused still on sick care when you get that definition. And I want to explain what the food as medicine true definition is, and that is using food to optimize your health, to prevent disease, manage disease, and in some cases, actually reverse disease. And I'll give you an example of this. I recently met the CEO of a company called Get Saucy. And he reached out to me because we're in this food as medicine space, and I got to hear his story, and it was really cool because he has Crohn's disease. He's a serial entrepreneur, primarily in the tech space. Now he's in the food space, and he has Crohn's disease, and he was on these biologic medications, and they were really wreaking havoc on his body in terms of other symptoms. And he wanted to find a way to use food and nutrition to reverse his Crohn's disease. So he followed the autoimmune diet protocol, which is by the Institute for Functional Medicine. So he followed that diligently. And guess what? It reversed his Crohn's disease and he's in remission. Well, the problem is the food was terrible. It wasn't tasty. He was missing all of his favorite foods. His family couldn't stand him. He said he was basically eating in a corner in his house. And so he went on his mission to create this company called Get Saucy to make some of these more basic foods that he could eat on his diet for his health really interesting and taste good. And so he really capitalized on that, hired some chefs, created these great sauces, and now he has this food as medicine company so that people can enjoy what he has created and enjoy meals with their family. But for him, nutrition and the foods that he chose truly made a difference in his life and the impact on his health. And he felt like it was like, how do I pay this forward? So that's an example of food as medicine in action. And it actually reversed his disease, or in this case, really put it in remission. So for me, in trying to explain food as medicine, I came up with 4 levels of food as medicine. And I think what's really interesting about this is where we typically start. And for food as medicine, for me, I think about that first basic level is whole, fresh foods. And it's the foundation of our health. It's prioritizing unprocessed, natural foods as your primary nourishment. And as you all know, highly processed foods, ultra processed foods is what we generally are consuming today. I think over 64% of a child's diet is ultra processed food today. And so prioritizing that as our main nourishment source is going to have major health impact on preventing disease, managing disease, and again, even reversing it. As we go up levels, we've got functional foods, moving into selecting specific foods for their nutrient properties to achieve health goals and optimal health. So this might look like following an anti-inflammatory diet, eating foods that are going to reduce inflammation in our bodies. So those are functional foods. They actually have a purpose. And then when we get into level 3, that's eating styles and specialty diets. So for instance, like the gentleman I was talking about with Get Saucy, it's really tailoring something to meet an individual's needs. And that's the beginning of precision or personalized nutrition. Everybody on this call today is going to have different nutrition needs. And if we did a nutrition assessment on every single person, even if we had the same, let's say, diagnosis, we all had diabetes, we would probably all need some different interventions around that. Level 4 is kind of that ultimate kind of highest level of food as medicine, and that's going to be supplementation, lab testing. That's where we're really digging into someone's specific needs and getting into that really, really tailored medicine. And that's a level that a lot of people will never need and don't need. So, however, this is the interesting piece, I think, in nutrition solutions that we use as employers and in healthcare. We tend to start people at this eating styles and specialty diets, and they're not actually ready for that. And so that is kind of the problem. We start with this really expensive intervention when in actuality, we should be starting with whole fresh foods and functional foods and try to educate people, bring them along, and empower them to make their own decisions about their health that's sustainable and lifelong and not that really high intervention. So I hope all of that makes sense to you. And again, you'll get these slides so you can take a peek at it and see how that kind of fits into your benefit structure or what you're discussing with your teams. So let's get into nutrition benefits. What's worth saving and what's not. And please chime in here too into the chat. Amanda, let me know if there's any burning questions in here too. We're going to start with that more of that level 4, which is that high level intervention. Private nutrition coaching, this is insurance paid. And overall, I can say this area is absolutely exploding. There are so many companies coming into this space, which as a registered dietitian, I'm thrilled that there are more opportunities for dietitians to share their knowledge, to interact with a variety of clients, and really help people along in the nutrition space. There are some cons to this though, and some things that are worth noting and discussing about this benefit exploding. So I think the pros in the insurance paid industry is that there's cost sharing and it's accessible for many employees because it's built into their health plan. It's often tied to a healthcare system and medical records too, especially if it's done through a healthcare system. So for example, I live in Minnesota. We have a lot of different healthcare systems around here. We have M Health Fairview, we have Alina. And if I'm in that system and somebody sees me, that medical record is going to be tied to that. So their physician is going to see that medical record too and what's going on nutritionally. Now, another question would be, I don't know if they'll actually read it. And this is also a very familiar process for employees. So they know how to use the healthcare system. People are used to making an appointment. They're used to showing their insurance card and doing that type of thing. So it's a very familiar process. Now, when we get into the cons on this, there's a massive administrative burden. And I think those of you that maybe work in the healthcare industry or have worked in the healthcare industry, this can be the burdensome piece of prior authorizations, billing codes, claim denials, delays in care because of that administrative burden. And there also may be low reimbursement rates. And there's not as many experts in nutrition nuances in terms of, I would say, community nutrition. When I worked in healthcare, a lot of times the dietitian that was seeing the inpatients was seeing the outpatients too. So it's not their core focus. And then there's also delays in scheduling, availability. And if you're self-funded, you're paying a higher price with no actual value for that too, because you're paying for the administration. Oftentimes poor utilization, and it can be a hassle for the employee. And if you're one of these organizations that are getting into the market, like Nourish, I have over on the right-hand side considerations. There's a lot of vendors now that are in the insurance paid market. Nourish is one, Dietitian Live, Food Smart has been in there for a while. Season Health is another one. Is that they're experiencing rapid growth, which I think is a great opportunity and alternative for insurance paid benefits. But the problems with that too are rapid growth. So you need to be really cautious, I think, about, or I shouldn't say cautious, discerning about asking questions about what their customer experience is like. How many dietitians do they have? What's their process for hiring dietitians? What's their experience like? And make sure that you're getting what you want in that employee experience, because ultimately, if you're getting a benefit for them, you want that premium experience for them and not for your employees to be frustrated. Other considerations in this space too are looking at if you're doing insurance paid, there might be coverage limitations for certain diagnoses tied to DRGs or CPT codes. Sometimes it can be harder to scale. I think the best place for private nutrition coaching that is insurance paid, they're best for companies that have smaller budgets, very limited budgets. They can't do a lot of other things. And then really take a focus on highlighting that your employees can use this and that it's a benefit that they can take advantage of to improve their health. So again, I think the bottom line on this is to really evaluate your vendor quality. If you're looking at one of the ones like Nourish, Dietitian Live, Season Health, and make sure that they're meeting your requirements in terms of what your culture is like and what you expect your employee experience to be like. And would love to know too if anybody is using any of these types of vendors. And again, without sharing, we don't want to like share anything that's we want to share like the challenges or some pros or cons with these too. So please put those in the chat, or you can certainly ask a question too. On to private nutrition coaching, employer paid. This is the space that we work in. I chose to, when I started this company, I was actually going to be in the insurance side and quickly decided this is not for me. I was spending way too much time on paperwork and trying to get RDs credentialed, and didn't seem to be worth it to me. I really wanted to focus on delivering the service and having that white glove experience. And the other limitation for me too was that we couldn't see people that really wanted to be seen for things like, say, it's polycystic ovarian syndrome or their fertility. Or maybe they just wanted to maximize or optimize their health. Maybe they have a history of Alzheimer's in their family and they want to really talk about brain health and how they don't want to get Alzheimer's disease. So that was a big con for me, which is why we do employer paid. And there's other companies that do that too. And the pros to this, and you can tell that I'm really an advocate for this, but it's generally cost saving. You're not paying for all the red tape of going through a health plan. It can cover all conditions and goals. There's no insurance red tape. It's super easy access for employees and a very consistent experience. It also signals an investment in your employee health, in your culture that you have, and it reaches employees without insurance coverage too, because not everybody goes through your health plan. So again, it's, I think, a signal that, hey, we care about you, and really driving home what we know is popular today and is evidence-based is that not only nutrition, but our health needs to be personalized. It's not cookie cutter, and it can't be just put into a neat little box and everyone follows it. And I think that's kind of the problem that we see in our healthcare today. And oftentimes we see better utilization. We've seen this with our clients that we have. They've had insurance based nutrition visits in the past. They move to this model and they see much better utilization and positive feedback from that. Now, of course, with every pro, there's a con. And the cons for this is it may not be a fit for organizations with limited budgets, or if you're fully insured, you may have trouble getting this approved. You may need to prove your ROI. That's something that we help our potential prospective clients deal with. And the care may sit outside the health system too. So whether you think that's a positive or a negative, there's some people think that's a positive. And then also I think a con with this is there's maybe some compliance issues if a company is inexperienced. Considerations for this, I think it's great for rural areas, those with limited resources. Again, I come from the state of Minnesota. I think of my local communities here, and I think of people living in rural Minnesota, northern Minnesota, that maybe there's one or two dietitians. They have to drive 30, 40, 50 miles to see a dietitian. This provides great access for them. It's a really high touch service. It's great for industries like ad agencies or law firms that really want that high touch experience, and it's part of your employee culture that you have and an expectation, a way to attract employees and give them what they actually need. And this can give you more flexibility too. You can really kind of customize and work with whoever your vendor is. If we're working with someone, we can customize any type of package for them. And you can get broader reach and engagement with that and reporting capabilities and data on your employee population, which I think is great. Next up, we're going to move. This is still at that higher level, like a level 3, kind of when we look at the food as medicine levels. We've got medically tailored meals. Many of you know them as MTM meals. And these really came into the market, gosh, maybe like 10 or more years ago, and they have gained in popularity. There's a lot of great vendors that are out there that are whole, fresh foods, which I think is fantastic. And I love that. Some of the pros for these, they're very clinically effective, especially for cancer, HIV, heart disease, many evidence-based outcomes with this, which is great. They can reduce ER and hospitalizations. And the way that they're used the best is for an immediate need after acute care. So somebody has a hospitalization, and if they can get those meals for 3 to 4 weeks post-discharge, it can really reduce a readmission or an ER visit, and making sure that they have, say they had surgery, that they have the best outcome from that surgery too. So it can be super effective. And then there's a cost savings potential, especially in a post-hospital stay. So for an organization that may have a lot of these types of diagnoses, this is something you'd probably want to talk to your broker about and look at your claims data to see if this would be an effective solution for you. The cons to this, of course, it's really high cost. There's limited scalability. It's a short-term impact with, we like to say, a long-term fade. So initially, yes, it's great, but is it sustainable? Probably not. And it's meant to be short term to get people kind of over that hump. So that initial cost savings on, again, ER admissions or hospital admissions, ER visits can be significant. So still a cost savings. But again, don't think of this as a long-term solution for behavior change. And again, it's a limited scope. So it's your sickest patients. You would not want to do this if you don't have the right population group for this. And the coverage varies by state and by health plan. And then there's this potential dependence too. So considerations for this, again, it's high touch, high cost, high impact. Best for targeted populations with complex needs. So if that's your organization, this would be a good win. It's not as scalable as a universal food as medicine solution, and it can work really well in Medicaid, Medicare space. So if you're on the health plan side, I think this is where we find them to be quite popular. Some of the most common vendors that you may have heard of recently, I think Mom's Meals is kind of the exploding one. But there's a lot of vendors that are out there, and you can just search MTM Meals in Google and you'll find a whole host of vendors. And again, you just want to make sure you find a vendor that's going to work for you if this is indeed something that's going to work within your organization, your population mix. Okay, on to food stipends. This is a favorite of mine. I actually worked with this when I worked in healthcare. We had different types of food stipends, and definitely have an opinion on this too. So this would be generally what most people do food stipends for fruit and vegetables. One of the positive things about this is it promotes autonomy and choice for people, and they feel like this is a big win for them. Amanda and I were talking about this, and we kind of had a little difference of opinion. She's like, "Oh, I think it's great," and I said, "I don't know about that." And Amanda can tell you more about her opinion too, but this can be certainly more cost effective than MTM meals. It can support your local economy. So if that's a part of your culture, again, I keep on bringing this back to the culture of your organization and what you want to do. You might be trying to buy locally and support local businesses too. So if that's part of that, this could be a big win for you too. It does provide flexibility in shopping, and it's a low barrier. So it's easy for people to get involved in this. Of course, here's the con part of it. I think, in my opinion, this is a little bit of a shiny object. There's no culinary skill development. And I want to ask the question, has anybody ever thrown away fruit and vegetables in their refrigerator? I know, nutrition is very important to me, and I've thrown away my share of fruit and vegetables out of my refrigerator, things that I never even, like, they're still whole. I hadn't cut them up, I hadn't prepared them, and thrown away a lot of fruit and vegetables. So I think the con to this is that you can have a lot of waste, and it's not actually moving the dial without culinary education and having a process for people to really consume their fruits and vegetables. So again, it's like potential for misuse. Limited behavior change. It's a short-term benefit. It's not sustainable. Think about, again, the food waste. And then the other thing that a lot of people don't think about too is the taxable benefit too. So that can be kind of a sticky point with employees. Other considerations with this would be, combine, if you're going to do this, combine it with a culinary education component so that you are teaching a man to fish and not just giving a man a fish. And it could be beneficial to have this tied to a reward. So, like, you complete something educational, you learned how to do something, now you get to get a $10 food stipend for fruits and vegetables every month, or $25, or get a gift card for a CSA, whatever it happens to be. And the other thing to consider too is your population and their access to fruits and vegetables. Where are you located? Are you urban? Are you rural? What does your population look like? Do you have a lot of maybe immigrants or different cultural backgrounds? And if you're going to do, say, a CSA, are the fruits and vegetables in there actually going to be recognizable? Will they know what to do with them? So it all kind of comes back to education again. And something to think about in this space too, instead of giving people food stipends, would be to think about partnerships that you could have, like a CSA drop off, farmers markets at your location, maybe even working with some other businesses that are local where you could combine and do a farmers market. You could also do a garden exchange. I've seen that happen. So there's other ways to really promote the consumption of fruits and vegetables without actually having a cost to it. The other thing in this space that I think it's a little outside of fruits and veggies to a little wider scope, but for those of you that have lifestyle spending accounts, making sure that you have some of these nutrition options in there for people, where it might be maybe they can get Blue Apron or different types of nutrition accounts that they can get food delivered, and they can choose what they want in terms of that lifestyle spending account on nutrition. So that's just some ways that you can do this kind of wraparound nutrition benefit with fruits and vegetables and promoting the consumption of healthy foods. But again, most beneficial when you pair it with education. On to meal planning tools, cooking and recipe apps. This would be vendors like a Food Smart, a Munch, a Plate Joy. These are some of these vendors are very legacy. They've been around for 20 plus years or around there, and have recipes, maybe short little cooking videos that can help you meal plan. And they have convenient recipe libraries and cooking inspiration. They're accessible to a very broad audience, and they're usually very low cost per employee, and they're simple to use. Now, the cons with this is a lot of times the content is outdated, the recipes are outdated. It still requires a significant amount of effort for people to use them. And they may be used to other ways of getting their nutrition content, like recipes, like maybe they have a Pinterest account and they pin things there, or they're using Instagram. I think this goes back to things have changed in the past 20 years, and the way that we consume nutrition information, recipes, learn how to cook is very different than 20 years ago. We didn't have access to everything for free on the internet. So this is, I think, one of the biggest cons of meal planning tools, cooking and recipe apps. You can right now, if I wanted to, I could go into ChatGPT and say I have ground chicken, broccoli, and quinoa, and a whole spice rack. Can you make me a dinner? Give me a recipe for a dinner. So you can use ChatGPT in that way, and other AI platforms for free. So I think that's the biggest con today as we're moving into this new world with AI, is that a lot of these vendors need to update and keep up with the AI component, or they're going to be completely replaced. And oftentimes these meal planning tools, cooking recipe apps, they don't have any clinical depth. So again, in terms of making an impact and moving the dial on what we're actually looking to achieve in our organization, they may not be doing that. Oftentimes, this is what I hear all the time when we're talking to prospective clients, is that they may be using one of these meal planning tools, and there is such poor utilization. And so they just kind of are turned away from it. They're like, nope, we've done that. It's not successful. We don't want to do it anymore. And so I think that's a big con to this. And we have to look at new ways of approaching nutrition and doing what actually matters. Another con is there's just minimal personalization. And again, that is the trend for health today, is that it's all about personalization because we are all unique and different, and what works for one does not work for another. So considerations on this is, again, it's the limited health relevance. There's not a tie to an ROI. Again, we go back to the legacy vendors that, a lot of times it's like check the box. And yep, we have a nutrition vendor and we've got that covered. We don't need to talk about anything else. It's often a slimmed down version of the vendor's full suite of services and no one actually uses it. And as I mentioned before, when we did the poll questions, nutrition science is rapidly changing, and a lot of times these just don't keep up with it. Now, I will say there are a couple, oh, do you have a question?
Oh, no, I just wanted to share that to chat in your questions here in the chat because we're going to get to questions in just a couple minutes too.
Oh, okay, great, great. Thank you. So next up, we have skills-based clinical nutrition culinary education. In this category, this is where we primarily work. Launch My Health, we don't actually know of anybody else who's doing this exact type of work, but for us, really it's about skills-based learning and helping people know what foods they need to eat for their health, and it's about their goals. And it's really low cost and turnkey, and it's about that total population. So if we go back to the food is medicine level 1, 2, 3, and 4, this is like level 1. This is helping people figure out how to eat whole fresh foods for their health and what their goals are. So level 1 and level 2. I think one of the biggest cons for this is changing the education around what we need to do with nutrition. So it's no longer about chronic disease management. It is about prevention, and it's about the rising risk population. So how do we have an intervention that's going to help our employees today, that's going to help them prevent disease for tomorrow? It's going to help them be productive. It's going to help their mental health. All of those things wrapped into one. And this is what we're seeing in the marketplace. And this is why I started this company, is that I wanted this nutrition information to be available for everyone so that everyone has the opportunity to incorporate nutrition into their health plan. So I think this is really, for me, I think there will be more and more opportunities in this space, and to think about, again, skills. So, and then as we get into the last couple ones, I'm not going to spend a ton of time on these because these are more generalized, but we do have well-being platforms. These would be examples, and there's a ton out there like Personify, Navigate, WebMD, WellWorks. They usually all incorporate some type of nutrition component into their platform, but I would call it nutrition light. So again, it's a little surfacey. It's good. I think it's supportive for other nutrition benefits and other nutrition solutions that you might incorporate, but don't think that it's really going to move the dial. It's more of that kind of softer side of nutrition and more of that inspiration side, but not going to necessarily move the dial on this. And the other problem with is it can get lost in a sea of content because usually there's just a ton of stuff. There's, topics on mental health, there's topics on fitness and stress, and this just gets kind of lost. And then we get into chronic condition management, where we have these would be companies like an Omada or an Oshi. So they're very specific to like gut health, or they're specific to type 2 diabetes, or they're specific to high blood pressure or cholesterol. And so overall, these are wonderful solutions, and they're great to have for those chronic disease solutions. But remember, these are the end of the line, not a total population strategy. And overall in these, I think they talk about nutrition, but they're again going to be a little bit light on the nutrition, and they're going to be more of that cookie cutter, like very specific to that condition, and may not address the personal needs that someone has with that chronic condition. So again, think about what your goals are, and this may be a great way to have nutrition incorporated into chronic condition management. but it's not going to apply to your total population. So you're missing a whole group of people. And then we have weight loss programs, lastly. And we all know that this is like one of the hottest topics right now because everyone's grappling with the GLP-1s. I've talked to some brokers and some employers that they are just absolutely sick of this conversation because it's what everybody's grappling with and trying to figure out what to do to cover it, not to cover it, and then what do we do about a lifestyle program to pair with it? So I think this is, again, a great opportunity. Make sure you're looking at who your vendors are and that they align with what your goals are as an organization. Do you want that white glove, personalized experience? I will just say here in this weight loss program section is that when you're looking at this, really look at the detail of what the program is. Because for me, this is my personal opinion as a registered dietitian, if you took a 25-year-old male and a 45-year-old woman and they're both trying to lose weight, those programs should look very different because the last time I checked, their chemistry, who they are, and what the issues are going to be probably very, very different. So make sure you ask questions about that as you're evaluating weight loss program vendors and make sure that whatever your culture is and what you want in your organization is aligned with that. And then I do want to just share too a little bit about AI and nutrition benefits, and we really want to think about how AI is driving some of these changes. As I mentioned, it's really completely changed what people have access to and can do on their own. I know I love AI. I think everybody's using AI today. So for us at Launch My Health too, we're doing this and how AI can add value. AI-driven meal recommendations, reminders for tasks. We can aggregate our analytics to your people now using AI. We have recipe generators. It can sync with your wearables and text so that the person, the end user, is getting all of that information, and it helps them make better decisions based on what's happening in their body. And then for us, we are going to have interactive feedback with our classes in 2026. So in our digital content, that will be available to use too, which I think AI is great for that. And before we get into questions here too, I just want to highlight that framework for evaluation. This is basically a 4 or 5-step process, and you can just go through these steps. Again, you'll get this in your email, but it can help you figure out if you're looking to add a nutrition benefit, how do you evaluate them? What's important to you? And lastly, making that decision based on this matrix where it's like, hey, clearly this is the one where we want to invest and is aligned with our goals and our budget. So again, you'll get this. It's very easy to use, and I hope you use it. And if you have any questions, you can contact us about that. And then I do want to highlight just a couple of examples too here of a strategy in action. This is a client of ours. Of course, that's all I know is really who we work with. This was a national retailer, and they had a very robust well-being program, and they decided to incorporate nutrition into their mix by starting with private nutrition appointments, where this is not typically where we see clients start, but this worked really well for them. And they have a culture, like I said, a very strong culture of well-being, and they actually have break rooms where they provide fruit and vegetables. That's another example. Instead of providing a stipend, have it in your break rooms that you provide. That's what they do. They make sure that they have a variety of cooking utensils and different types of equipment in their break rooms so people can cook at work. And they also have incorporated nutrition and cooking into their daily huddles. And like I said, they started with private nutrition appointments with us for their employees, was super successful. They got great feedback, and now they've added in our digital suite and Launch Live, our webinars. So great way to just kind of see how that strategy has happened in action for them.
And Brenda, I just want to share with that client.
Yeah.
As you said, they're a real retailer, so they don't have just one corporate campus where you can easily manage your break rooms. They're across the country, tons of different locations, and just shows their commitment to this, that they've figured out a way to source the fruit and veggies and to really do that break room facelift.
Yeah, thank you for that. Because that, I mean, I think retail, I mean, there's so many industries that are difficult to reach. Some of the most difficult ones are the non-corporate ones where people, you have public sector where they're out in the field, you have truck drivers, you have manufacturing. Um, in this here, like we have a large university system, that can be really difficult. You have people who are not sitting at desks all the time, and that can be one of the biggest challenges. So finding something that's going to work for you and work within your organization is key, and not just kind of again going at the shiny object, but um, really be planful and discerning about what's going to work best for you. One other one I just want to highlight quickly is this mid-size county under 1,000, because I think this is a common case for people. A growing well-being program, but very limited budget, very limited resources. And they do on-site farmers markets in the summer. They're really trying to do what they can with what they have. And for them, they had enough money. They wanted to start with digital courses with us, and they just chose two. They couldn't do all of them with us, and that was okay. And they now this year they're moving to our full digital suite of courses because it was so successful, and they have engagement. So you can start small and build, and I think that's a great way to get engagement, is to kind of test the waters and see what people are interested in, and then you can move forward. And that's one of the things that's important to me is flexibility. So I'm going to quickly just share for those of you who are new on here and don't know who we are. We're again Launch My Health. We are a clinical nutrition and cooking benefit. We teach people what to eat and how to cook. So we do that with skills and very personalized medicine. We support health, whether it's chronic disease management, weight loss, and then we have specialized focus that is not diagnosis based, that really is personal goal based, like women's health, gut health, longevity, brain health, you name it. And we're doing it, and we're creating new content constantly. And then our service offerings that we have a digital platform, as I mentioned. These are the courses that I just talked about, like gut health, our women's health courses. We have a brand new one coming out in 2026 on the cycle years, which is a women's reproductive years. We also had the ever popular Launch Live. This is where we a lot of times recommend people start if they're not sure food is medicine is for them, or if they just want to kind of dip their toe in and see what the response is from their employees before investing more money. So we do these 12 turnkey monthly webinars. We also, as I mentioned before too, we do these private nutrition appointments that are not through insurance. We can do a carve out through a health plan, but they're one-on-one with a registered dietitian, and high quality white glove experience for any organization. And then we lastly have Launch Med, which is our weight management program that's with or without GLP-1 medications. And we mix and match any service that anybody needs. So that's kind of who we are at Launch My Health, just so you have an idea. You'll get this information. This is just our some outcomes that we have, but I'm not going to, in the interest of time, I'm not going to go through that on here, but you'll get it in your slide deck that you get. And Amanda, let's open this up to if there's any questions from the group.
Yes, ask your questions here. One that I wanted to get in that we were talking about the other day was with the weight loss programs, that a lot of times they're built together with the lifestyle component and the prescriber, and that there is a little bit of a conflict of interest there. Could you just give a quick note on that?
Well, this, again, I think there's a ton of conversation happening about GLP-1s. We're having a lot of conversations about GLP-1s, and that's just one of the topics of discussion is if a lifestyle program is also the prescriber, is there an incentive to keep them on the medication too? So it's just kind of looking at, the I don't know if I want to say like ethics of that kind of situation, but just, what kind of motivations are there? So that's just something to ask too.
Yeah. Other questions. Where do you see the nutrition industry going in the next 2 to 3 years in lieu of all of the AI and the GLP-1 trends?
I think GLP-1s, to answer your last part first, are still going to be a hot topic for years because I think it's just a fast-moving train. Um, I cannot predict exactly what will happen with it, but I think I think it's going to be a wild and woolly drive, and that's going to impact how our health plans. We already know it's a big conversation. It's going to continue to be a big conversation. And there's a lot of research that's happening in that space too. So we'll find out more about that. Um, and in terms of AI, I think this is where I think legacy companies are really going to need to think about how they survive into the future because I think there could be some blockbuster kind of moments with some of these how we approach nutrition because it is so much more accessible now. I think you have to have that personalization that's going to happen. I don't think just like in healthcare, there's never going to be a replacement for a physician. Yes, AI can help that clinician. AI can help me and our company as dietitians here. It will help us. Um, it'll help us be more efficient. It'll help us provide better resources to our clients, but it can't replace that clinical brain that we have to put it all together for somebody. So I think that's the space that nutrition will have to go is that it's going to have to be personalized.
Yep. Okay, another question is, we get this one all the time. How do I convince the executive team, specifically my CFO, that that this will deliver an ROI, that any nutrition benefit can deliver an ROI?
Well, I think the biggest question is or not question, comment about ROI is that for anything that we're doing here, we can't for sure say that it's nutrition that's doing it. There's too many factors. So you can't, I mean, if anybody does have an ROI, we have that kind of thing too. We can use estimates, we can use data that's out there. But unless we're doing an actual formal study on that, we can't say for sure it was nutrition that did 100% of it. So that can be challenging. But with all the research that we do have, we can make a really good case and we can help our clients with that, make the case for that. But the fact of the matter is 80% of our health is tied to what we eat. And so it's really difficult to argue with those kind of things, especially if you have the enrollment and the engagement. Um, and for us, like we show our outcomes where we're seeing patterns of eating change, and we know that that's going to have long-term results too.
And this one, the very best claim I can help an employer with is the one that never happens. That's from Bob. Thank you, Bob. It's so true.
Totally. Exactly.
Yes. Well, that's all we have for today, everyone. Thank you so much. And Brenda, any final words as we sign off?
I think I want to highlight this quote on here because I love it. The food you eat can either be the safest and most powerful form of medicine, or it can be the slowest form of poison. And I like this because we don't feel what's happening in our body as chronic disease is happening. We don't feel that change on a day-to-day basis. It's not like breaking your leg. And so we need to think about the food that we're putting in our mouth on a daily basis and make sure it's serving us for our future too.
Wonderful. Thank you so much. Thanks everyone for joining us. You will get an email tomorrow with the recording, slides, and that framework that you can use and apply to your own work. Thank you.
Thank you.